once again by Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health. Doctor, thank you so much for being with us. We always appreciate your time. We truly do. The U.S. is quickly approaching 60,000 new cases of COVID-19 every day. Is it possible to know yet when the U.S. will reach a peak? And how bad could this get? Because we keep saying, oh, here comes another spike, here comes another spike. What's the answer here?
So, Maria, none of us know how bad this is going to get, but it's pretty bad right now. We're nearing, 60,000 cases. And when we started this, back in the spring, we started about 20 to 30,000 cases when New York was on fire, when Massachusetts was at its peak. So as we approach winter with that many patients, it's not looking good. We have to double down on our infection prevention, measures.
A group of scientists, Doctor, recently wrote the Great Barrington Declaration promoting herd immunity as a strategy to fight COVID-19. Why is it so controversial?
Right, and my Infectious Disease Society has pushed back on that. Here's the issue. It sounds good to say if we just allow the least vulnerable people like children to get infected and protect the most vulnerable, then we can allow everything to open up. That certainly sounds good. The problem is we're too interconnected. The CDC report that we talked about before, 20 to 30 age group became positive, then within 2 weeks, over 60 became positive. So that's dangerous. 200,000 people have died so far over that, and only 10% of the population is immune. So when you think about extrapolating that to 50, 60%, that's a lot of deaths.
Yeah, and by the way, the Great Barrington is Great Barrington, Massachusetts. It's just so to connect those dots.
Public health officials believe that young adults, they're fueling the spread of COVID-19 right now. So do you, in your opinion, do you believe that that should influence who gets a vaccine first, if they choose?
Right. So the National Academy has come out with recent recommendations. They were commissioned by the NIH to do this. And basically they said there's going to be 4 different phases. The first phase is the most vulnerable patients with chronic conditions, elderly living in group homes, potentially frontline providers. The second wave will be those people that are elderly, not necessarily in group homes, and then people that are at high risk, teachers perhaps, and then the last wave is going to be those children that you mentioned. It's a good point. You want to get those children vaccinated because they may be spreading it, but I think at this point we want to think about protecting those most vulnerable for severe infection.
The pandemic has taken a heavy toll on a number of industries, but of course the travel industry is right there at the top of the list, and there's a new study out about the risk of spreading COVID on an airplane. So a lot of people want to fly. The holidays are coming. What does it show?
Well, it's a very encouraging study. When we talked about people, place, time, and space, you'd think that planes would be a very vulnerable place where there's lots of transmission. It's indoors, it's crowded, you're there for a long time, there's no space in between. But there was a study done by the Department of Defense along with United Airlines. They had a dummy that was basically masked and generating aerosols. And what they showed is that only 3 per 100,000 particles actually got in the airspace of the next seat, and they didn't get into the galleys or any other parts. So overall, it seems like because airlines have such great ventilation and filtration, that it seems to be a pretty safe place to go.
Interesting. All right, Dr. Ellerin, great to see you as always. Thank you so much for your time.
Thanks, Doctor. Be well.